I am ready to place the speculum, and we are going to use the Virion system to do the pre-registration and the pre-docking first. Now, as you can see here, can you just show it here? We are basically now bringing down this, we have not yet pricked the PI over here, and we are now going to come very close, and now I think you can go to that screen over there, zoom out करके दोनों screens दिखाना. And now I'm going to do a focusing over here.
This yellow part has to be on the limbus. Can you see this line?
So this line over here has to correspond over the limbus, and once it corresponds over there, I'm going to click, and now this thing is on the limbus, and now if you it's trying to take a registration, it says registration in progress over here, and now you can switch to this screen over here. It is now showing me these two blinking screens. So one is showing the pre-image capture and the other is showing what we had captured now. If they both correspond, then we press this button called confirm over here. Now as soon as I press confirm, it says waiting for docked image, which means that now it has registered the scleral vessels. Now the second image will be taken later on, where it will do the iris registration once we have docked. So now it says over here waiting for docked image. I am going to fix the PI now, and here this patient has the right eye. We have already fixed the soft fit contact lens over here, and it's already in place. I'm going to now fix this PI in place. Here one has to be very careful that it doesn't get wet from the outside, as Maheshwar always tells me. And now we put a drop of paracane. Now if you'll just show here, we are fixing this suction ring over here. The moment I fix it here, this thing is barcoded, cannot be used twice. That is why Alcon makes all the money from these PIs. Now it's turned green. Once it turns green, later on it cannot be reused. So now we are ready. माधुरी जी थोड़ा सा ठोड़ी को ऊपर कर लीजिए और ऐसे ही रखिएगा बस इतना ठीक है. So with these new PIs, I think Dr. Mahipal has experience with the bigger PIs which were being used before, and now these are much smaller and more comfortable for the patient. And we are going to dock now. So I'll just show you on the screen as we dock. We are going down. Now you can take it over there actually. So I think, can you see the screen now? I'm centering it a little bit, and we'll just do the docking procedure at this time. And as we dock, you'll see this small dot move up over here, and it has to come into the green zone actually.
When it touches, this will start to move up. Okay, so now it is touching the eye.
So you can see this small bubble now. This is time when we switch on the vacuum, and as soon as I switch on the vacuum, the interface will be locked on. So now we are in a position to actually obstruction. Okay, so there is a small obstruction here on the nose. The nose is blocking it, that's why it's not locking on. I'll just recenter it a little bit. And now I try to do the thing again.
At any stage, you lose suction, you press stop, and again you can do
okay,
that.
So I think we've now docked, and we are in the green zone. As you'll see now, I'm in the green zone here. I've taken
in the green zone.
So now I've taken
that means that the pressure on the eye
zoom out and show here.
should not be more.
Now it says, so now you can see the Virion, it is trying to lock in. It says registration done, and it is asking me whether I'm sure that the centration is fine. I can see the limbal vessels there corresponding. I will click confirm. Now it will give me another view here. So it is saying registration successful, and it says that cyclorotation is of 5 degrees.
5 degrees. See, you can see it now here. That
so
means that the eye has rotated 5 degrees between.
So if we had gone with the prior surgery, we would have misplaced the toric IOL or whatever by 5 degrees on the incision. So now I'll again click on confirm over here. As soon as I click now we are ready to go over here. So if you'll see on the screen now, I can now play with the parameters, and I'm going to first see whether my incisions are right. So my main port incision over here, I'm going to just see if I want to move it a little in. So it's coming too much on the limbus, I've moved it in a little bit. I'm also going to move in my side port incisions a little bit. Although the Virion has already set it very right, but I'm just trying to set them to my comfort level. I don't want to let them come onto the arcus or area of the limbus. So I've brought them in. Once these are fine, then I also go to the primary incision a little more in for my comfort. I'll be happier here. So I think you can see now I've moved it in a little bit. Then I click on the lens button over here. Now I can play with the lens parameters. So you can see this pink line. This is for the capsular axis. I can make it smaller or bigger, right? So that they can't see. So I think I'm going to leave it where we had initially planned it. I'm just doing it for showing you. And now this is for the lens fragmentation. I can move this around if you want. So I'm moving it around to my comfort zone where I want. I'm centering it. Although Virion already did it. I'm just showing this for the sake of showing, because these are not required now ever since we started using Virion. I've clicked on scan now.
I'm using a matrix pattern.
I'm using a chop only because, as I told you, that I'm not even using a. So now I'm going to zoom in on this screen here. This is for the capsular axis. Now this is, we can choose the highest point over here with my finger. I'm showing you. I'm just resetting it a little bit, and I'm showing you now the lowest point over here. And now once I'm satisfied, now I'm going to zoom out. Now I can see that it is perfectly aligned and it's equidistant. These two pink lines are at equal distance now. And now I'm going to the next step. Now I'm showing the lens. So we are now, the OCT scan has shown me that the lens is perfectly placed for the capsule from the default from the capsule as normally it gets. But here you can see that it is much higher than what I need. So I'm putting this pink line down now, and now this pink line is corresponding to the posterior capsule.
What is that reading there? 700 something?
Yes, it's 7,276.
Okay.
Okay. So now we've got this in place, and we click on accept over here. So 2 parameters are already done. Now I come to the cornea thickness as Dr. Maipal and Dr. Pakrasi showed. So you can see this white part, which is the arcus. This is incision is to my preference. I'm just going to move it a little bit further here. That's about it. And this is absolutely fine. This line is absolutely fine. I think I'm happy with my incision now. And so I think we've all set. Now I'm coming to this button called verify and accept. So as soon as all this is done, I click on verify. Now we have the laser going to be ready. So you can keep showing this screen now completely. And it says laser ready over here. Now you have to watch over here for the rexis. Keep showing this screen only. And I'm firing now. So the rexis is now happening over here. This is the rexis going on.
This came a little later. So there was a difference between the highest and the, little bit. It's not much. Go ahead.
It's going on. The laser is firing. We've completed the capsular rexis. Now our nucleotomy is happening. You can see the chops taking place. And I've been experimenting with all the 3 different patterns, and I find all of them good. I like just now the incision is happening over here, and the 2 side ports. This patient did not need an LRI because the astigmatism was higher. So we released the vacuum. Can you switch on the lights in the room, please? And you can focus over here, focus here, zoom out and focus over here. So now we are undocking the PI from the patient, and as soon as that happens, then the patient can actually get up and walk to the other room. And now we'll switch you to the other one. Dr. Maipal, please take over with Dr. Pakrasi, and I'll be with printout. This is the Virion printout. Actually, once we are using Virion, it doesn't matter, but just to be manually sure that we have a backup available, 1% is the Virion is not able to register the limbus version. Not there, it has happened till today. But on this, we have all the IL calculations, and we use the toric planner on the LensStar now, which is with the T-cone. So this actually is showing here that 0 astigmatism at 11 degrees now, because we can now rotate it and set it. So LensStar gives us amazing capability to actually get the K readings in a more accurate way using the Placido disc as well as the LensStar normal case. And then those we are using to actually do the IL calculations, and then on the Virion we can have the post-SIE astigmatism. So actually I believe a lot in this post-SIE astigmatism rather than the pre-operative astigmatism. So this Virion actually gives you post-SIE astigmatism. Some patients who are actually maybe 0.8 astigmatism pre-operatively, if you see the post-SIE, it could become 1.1 or 1.0. So that matters, and some of these become toric candidates which otherwise they may not be. So using this data now, we are obviously going to start with the surgery. I'm all set. LensStar normal case, we take 1 reading with the LensStar T-cone case, and we take 3rd reading on the Virion. Mostly they correspond. They would be different by maybe 0.1 or 0.2 at the most. But I have learned to rely maximum on the LensStar 32 LED case, because the T-cone gives the best access. The LensStar gives. Virion I'm still evaluating because it's early days. I've been doing it only for 2 months. So we are still collecting data. We already have data of about 150 patients on the 3 machines, but we are still evaluating it. And with Warren Hill, we discussed there in Jaipur that we are going to study and put this data for further evaluation. Using more of the ready to open my incisions, and as you realize, we need to dry this. I have learned the hard way that if you don't dry it with a swab before opening these incisions, they sometimes will not open. So I just kind of mark it a little bit, and then you can see it opens quite easily. And then I mark the other one. So first I use 2 side modes because I do a bimanual surgery, and I'm going to now just, I hope I'm well centered. So very rarely my incisions will not open, I must confess, but let's see here if it...
So what would be the significance of that overlay incision point? What is the significance of these 3 blue triangles which you are seeing? Just to reconfirm your openings? On the Virion? Yes.
Actually, I'm not getting the overlay on the Virion right now, but are you?
Yeah, we are.
Okay.
So it's a confirmation, because like it always should be checked.
Right.
That you are in the correct axis. Otherwise, there would be a torsion, which would happen if the registration does not happen.
Test the OT patient legacy. Okay. So now I'm trying to go and try and open this one. It looks a little dicey as the epithelium has been touched over here. So, but I'm still trying to see if I can open the other side port incision. Because once you get into a false plane, then it will not open. So thankfully this one has opened nicely. And now I'm all set to open the main bone. Dr. Pakrasi, how has life changed after the Virion came for you? Because I got inspired by your Virion usage and I went with the Virion. Initially I was planning to get the Lensex and I've been very happy with the...
See, I think it's completely changed at least my surgical quality to a huge extent. How you're trying to enter beyond the incision area.
So it's important to actually get into the plane.
So do you normally sort of try and cut the epithelium at the edge of the initial vertical groove?
That's what I do. So first I go, you saw that I have a triplanar incision.
Yes.
So I first make that get into the groove over there, and then once that is done, then it becomes much easier. So I'll try to see, contact karo please. The rexis by injecting under the rexis over here. That's what Dr. Maipal was saying. So as I inject viscoelastic here, you'll see that the tag has floated with any attachment. So once that is done, I can use the rexis forceps to remove it, but I'm just wondering whether there's a small tag right there. I'm going to just see if it's refloating as I think it is.
You know, what he is doing is very interesting because there could be a couple of tags which could be left behind.
So I'm happy that there is no tag. I was a little bit concerned. Rexis forceps.
I think this is a very crucial step because we do make mistakes by trying to take off the capsule. If it's free floating,
Let me see, I'll try to first remove off some of this debris which is above. The Centurion has really made life much easier for the hard cataracts when I'm not doing Lensex.
Are you using the balance tip by any chance?
Yes, I'm using the balance tip. What about you?
Would you like to say something about it?
Yeah, the balance tip is actually amazing because it kind of, for the phaco efficiency, it has made a world of difference. These settings kiski hai Centurion pe? Are these my settings?
Yes sir, your settings.
Okay, go to grade 2.
Procedure 2. Chop.
Okay, so I'll try to embed now and see if I can open these chopped wounds. Yes, so they're already opened up there. Now I'll see if I can rotate it around. It's a bit of a sticky kind of a cataract. I don't know how your view is.
Well, it's not very clear, but I think we can see what you're doing.
So I can still see some air bubbles trapped behind, which is a bit of a worry for me. So I'm going to remove this one fragment from here so that the air bubbles are no longer trapped. It is decentered, but I'll just bring it back. So I've just removed this one fragment, which is not too happy about it because now there shouldn't be any air bubbles actually. And I'm now opening up this one. I'm not doing what I typically do. I'm a little worried because I can't free those air bubbles behind the nucleus.
Gaurav, there is a small query that if you just tip the nucleus down, would the air bubbles come out to the side?
That should normally happen when I rotate. Normally that should happen. So, but here it didn't happen. So you can see that I've almost got these fragments out. They were already chopped. And
are you at the iris plane or you're above?
Right now I'm at the iris plane because I don't want to go behind. I'm a little suspicious about why those bubbles have not come out, in spite of having removed everything from there. I can still see some air bubbles behind, so I'm now going to remove some of these other pieces. The cataract has become really soft actually.
Cataract removal.
You're using pretty modest settings. Is that because of
That's how
the
I
balance
normally,
tip?
that's how I normally use.
Is that because of the balance tip that you've reduced?
Yeah, the
or-
balance tip I have cut down because with the Infinity I used to use 100% par. Now I'm down to just about 60 to 70% Feco par.
That's nice.
So we've got that out of the way, and now I have. Can you see that there's still a bubble there?
Yes, you can still see that.
I'm wondering why it is still there.
Well, it's probably in the epinucleus somewhere.
Yeah, so I was worried.
Behind this left, you'll be able to probably get it.
I was
Yeah.
a little worried about the lawless effect.
Yes. Could you explain what you just said?
Maybe you can do that for me.
Volume. And in this situation should make a difference, but when you're doing the intersection, it could suddenly increase the level of the pressure. And we've had, especially with the posterior polar cataract, etc., suddenly the whole thing will burst out. But any comments about this?
So I'm happy now that those bubbles were just coincidentally there, but I have a posterior capsular plaque, and now the cortex removal is a little different. I think Dr. Maipal and Pakrasi can explain to you that at the edge of the rexus, because the settings of the laser are such that it also cleaves the cortex besides making the rexus, so it tends to actually become difficult to, you don't have any of those tags hanging out of the rexus edge, so they are also cleaved in plane with the capsular rexus, so getting it out can sometimes be a bit of a challenge. And I was seeing how elegantly you guys were using the coaxial, and while I'm a big fan of the bimanual, but I did realize that you were doing a great job with the coaxial. And
See, actually having that vertical cut into the epinucleus area can both be a boon and a bane, because if you're saying rightfully that you cannot see the tags, then you don't have anything to purchase your aspiration tip. However, if you go very, very clearly under the edge of the capsule, you have a very clear edge which you can hold, and then I think you're doing a great job, by the way. But why do not you use the coaxial?
because I never used it for 15 years when I started Feco, I've always, so somehow, it gives me more kind of, the chamber is much more stable for me when I use bimanual, and the access to the, should we use auto sir?
That's done very elegantly, but I must say that the bimanual is probably a much safer and a better option to actually exercise.
Okay, so they've actually loaded my lens onto the manual injector, so you won't get the benefit of seeing. I love the AutoCert. It really makes IOL injection much more stable, but for some reason today, they've given me the option to go use the manual injector itself after seeing your this thing. So I've been using it for about a year and a half now, and I thought that it was is this a D cartridge?
Yes, sir.
Okay, so you'll see here I'm not using any Visalon, I'm using wound hydro-assisted injection. Dr. Maipal and Pakrasi, can you observe? No Visalon here, I'm doing hydro injection of the lens. I hope it works. You'll see that it goes in quite elegantly actually. And this I started doing about 6 months back when I had an instance of TAS.
Yes.
So I've injected the lens under infusion, and I have to now just, you can see that it runs around inside if you are not careful. This is a toric lens, and I have now managed to get it in its place. I'll try to show you the visco and toric.
Actually quite interesting, quite elegant.
Okay, so now this ensures two things. There is no viscoelastic trap behind the lens. एक मिनट यार, तुम लोग छोड़ दो. Let me first get the lens open. So we have the lens open now, and I'm going to rotate it. So what we need to do is now go to toric and then go to visco. Okay, toric and back visco, back to visco. Back to visco. So Virion display is not coming, please. Virion is not showing me anything. It's not in my microscope, it is not visible. The MID is off.
Then subsequently.
No problem. Please go ahead, sir. माइक्स को ऑफ कर लो प्लीज. माइक हटा लो. Off kar do basically. Can I get video on display? I don't have video on display. In the MID there is no video.
The question which has been asked is,
वहाँ पे देखो नहीं
It is-
video नहीं आ रहा भाई.